after your ankle surgery, right? So how long it's been since I did your surgery?
5 weeks tomorrow.
5 weeks tomorrow. Okay. So you know why I'm doing this video, right?
Yeah.
So because I think you're a superwoman, because you're probably like one of my best patients ever, who had an ankle fracture, who had a complete tear of the anterior talar fibula ligament, and you also had like injuries before that, right? And I did surgery 5 weeks ago, and you're telling me you're exercising, you're walking on it, and are you having a lot of pain?
I'm having no pain.
No pain?
I haven't had pain for weeks. I mean, it doesn't, I'm just doing my therapy like you said, and
Good.
that's what's important. That's what I mean, I'm
Right,
doing what
right.
you told me.
Well, let's kind of travel back in time. So tell me how you ended up in my office.
Well, I didn't think I broke my ankle, but apparently I did, and I had just a basic boot from Dr. Lipson's office in Sebring, and after 4 weeks she said that it had moved, and bone moved, and so I said, oh, okay, I'm going to see my doctor. I'm going to see Dr. Wellens, and I came in, and that's when you told me surgery, and we got right on it.
Yeah, so you had like a fibula fracture, right? And unfortunately, it moved a little bit during the healing time, right? And basically, as I told you, is like we always try to heal it without surgery first, but when there is a displacement, we know that unfortunately it will affect you long term if we don't fix it.
Oh yeah, I had no doubt I was going to have it.
Right. And remember how you also, when we did all the tests that showed that you had a tear of that anterior talar fibula ligament, probably a chronic tear. But again, like it doesn't matter. A tear is a tear, right? The only way to fix it is to repair it. So basically, obviously, I took care of your fracture and then I repaired that tear. But I have to tell you that the reason why I'm doing this testimony is not to tell anybody that I'm a great surgeon, but really to
make... Well, you are, because I wouldn't go anywhere else. You did my bones for me.
Right, but really to tell people how important it is to do what you're supposed to do, because you're a true example of how, you know, an ankle fracture and a ligament tear is a devastating injury, because usually people are in your shoes about 8 weeks from surgery, not 5 weeks, you know. So please take it as a compliment.
Well, I wanted good news. My birthday's Friday, and I'm like, I'm going to get a good news, good report, because like I said, I've been doing every single thing. I mean, it's a big difference from 2 weeks ago when I came and you told me to use that board, and doing my therapy, and I've been doing it every night, and just trying to strengthen it. And I still put ice on it after I do my therapy to keep, you know, any swelling. Just I've just been extra cautious, but I'm very active, so
Right. Well, I'm gonna show everybody a video of your foot and how good it looks. So it's just a tiny band-aid, and then just a little stitch that you spit, but other than that, I mean, I wouldn't even know you had surgery done there. That's amazing.
Right. Well, when I walked in, she asked me where my shoe was, and I said, well, I have it, but it, you know, the even up doesn't flex with you, so I said, I want to walk right, you know, so, and I've been practicing, like when I was going up and down the stairs to, you know, of course I wanted to turn out, and I was making sure, you know, the flexion went that way up and down the stairs, just
well, good job there. I mean, this is unbelievable. And I think like one of the things you said, I've been doing my physical therapy every day. I think one of the biggest things I see in my practice is I give somebody a prescription for PT, and they go like twice a week and they do nothing at home. So they get about like, what, 30 minutes twice a week, and that's it. I mean, the key is...
at home by myself. Like I got everything you said, I mean, if you're not going to do your physical therapy, your surgery is only going to work so well.
Right.
I mean,
I think I told you that when I was a resident, I was rotating with one of very famous surgeons who were doing a lot of surgeries for the Miami Dolphins.
Oh yes.
And that, you know what he used to say when he walked out of operating room? He would go to the bed of a gentleman or a lady and say, I did my 50%, the other 50% is you.
Oh, absolutely.
So if you don't rehab properly, all these fancy surgeries and anchors and screws are just not going to do it.
Right. I want full, complete usage. I want to be back to...
You want to be better because now you don't have the limitations of having that unstable ankle.
Right.
Well, good job, dear. I'm so
Well,
proud of
thank you.
you.
Thank